Hello out there in television land, Philip Benyo with my bride, and we are going to initiate another adventure called It's Your Health.
Absolutely. We have so much to talk about.
We'll be right back after this brief commercial message. Remember, you're watching It's Your Health. We're your leader in healthcare information. Right, sweetheart?
Right, sweetheart.
Welcome back to the first segment of It's Your Health.
Yep, that's the name of it. It's Your Health.
What?
You don't have to hesitate when you say that. You know the name of it. It's Your Health.
It has been a brutal winter, as you can tell. Too much cabin fever. I just can't get over this winter. It just won't let go. And
Oh, it's going to. We're going to have beautiful weather.
okay,
It's going to go right from winter to summer.
that sounds buggy.
I know, that does, and snaky, too.
All right, are you going to start us off here, kid?
I'll start off something that's buggy and snaky.
All righty.
Okay. Alzheimer's strikes women harder than men. Why is it always the bad stuff that it strikes women worse than men? Don't answer that. A 65-year-old American woman has a 1 in 6 chance of developing Alzheimer's disease later in life, while a man about the same age has a 1 in 11 chance. Women in their 60s are twice as likely to get Alzheimer's than breast cancer.
Big problem, and it's going to become bigger as our baby boomers are retiring. We're going to have an explosion of dementing illnesses. Keep in mind that women live longer than men, and so it may actually be that these women who live longer are actually developing the illness because they're living longer. And most of us will develop a dementia-like illness if you keep having birthdays.
Well, that's certainly one way to look at it. Stop living so long and you won't have to worry about all these problems coming along. And add to that is the majority of caregivers for Alzheimer's patients are, guess who?
Gals, right?
They're women, that's right.
Yeah, we're in bad shape.
Yep, the men are just sitting around letting us do it all for them.
Can you give me the channel changer, please?
No, next headline. Most women don't know the warning signs of a stroke. Most women said they call 911 if they were experiencing a stroke, but they don't know the warning signs. Only 51% of women knew that sudden weakness or numbness on one side of the face, arms, or legs is a warning sign, and hardly any of them knew that a severe headache, dizziness, or an immediate blindness are also signs of a stroke.
Another big issue, keep in mind that you're at risk for stroke if you have hypertension, diabetes, if you smoke, if it perhaps runs in your family. And if you have heart disease, for example, you're at risk for this. High cholesterol, don't forget that. And brain time is what we're talking about here. The longer you go on with stroke symptoms, the less likely it can be reversed. So it's crucial that you get to an emergency room as soon as possible. Don't kind of wait for it to go away, because there's a small window in which we can give you clot-busting drugs to help preserve your brain.
Well, what if we get this severe headache and we say, oh my goodness, I'm having a stroke, I have to call 911, and it's nothing?
That's great news.
So they're not going to say, what are you doing here?
Of course not.
I think women are nervous about making a mistake.
I'm glad you don't make any mistakes, because that's why you don't get very nervous.
I didn't say I don't make any mistakes. I never said that. You said that. Are we starting an argument right here on public television in front of everybody?
I'm getting nervous.
Oh, you should. And let me sit and relax just for a moment. Because too much sitting after age 60 may lead to a disability. We know that too much sitting has been linked to increased risk for health problems, such as heart failure and earlier death. Regardless of how often you do moderate exercise, The more time spent sitting, the more likely you are to be disabled. How do you like that?
Well, that is true.
I gotta stand up.
You don't use it, you lose it. And particularly after this winter. So I would encourage you when the weather breaks to get out there and try to get a little more physical, do some yard work, go for some walks, some exercise.
Walk the dogs.
Right. We have a rower at home that she's been trying to row the boat.
Poorly.
But again, get out there and get active.
Absolutely. And speaking of taking care of ourselves, we also need to care for our family members, because women, you know that it's our job to take care of everyone. They are not obliged to take care of themselves. Oh no, it's up to us to do it. And that includes our dogs. So let's talk about some good things we can do for our dogs. Well, every once in a while we can feed them some fruit and vegetables. Dogs love blueberries and strawberries, and they're good for them. Some dogs even eat them right off the vine. We also know that omega-3s, is that what they call?
Yep.
Will help dogs who have arthritis. In fact, when our Golden a few years ago was suffering from arthritis, we gave her omega-3s, and that helped her tremendously. So we know pretty much what's bad for dogs. We talk about chocolate and garlic and toxic substances, but remember what's good for dogs and give them a treat once in a while, but a worthwhile treat. Our dogs love carrots. I don't buy them. He buys. He goes grocery shopping. I don't grocery shop for obvious reasons. Anyway, he buys the little carrots that I feed to the dogs, and they love them.
Speaking of dogs, this woman just got 2 puppies, and she named the one puppy Timex and the other one Rolex. Because they're watchdogs. So.
You're the only one laughing at that.
Okay.
The only one.
No, the millions out there in television land are howling.
Oh. Let's talk about something we shouldn't give dogs, but is good for us. Chocolate.
Great drug.
Yes, it is. Small pieces and stick to dark chocolate. That's what's better for you. It lowers the risk of heart disease and stroke by 20%, improves longevity, and that's also true for alcohol. And that's not just wine. It could be beer. Any kind of alcohol in moderation also provides the same kind of benefits that the dark chocolate provides. And the latest thing we're seeing is the dark chocolate mixed with an acai berry or something like that. That's very good. That's a very good combination of the berry and the chocolate.
Everything in moderation.
Everything?
Including
right
this show. We'll be right back after this brief commercial message. Remember, you're watching It's Your Health. We're your leader in healthcare information. Welcome back to the second segment of It's Your Health. I'm here with my bride.
You're right, it is It's Your Health.
And make sure you check with your healthcare provider before doing any of the things that we talk about here on It's Your Health, especially with regards to your dogs.
Yeah. Well, no, just especially the dogs.
Okay.
Are you done now?
Yes,
you don't have any jokes to tell, do you?
No, I'm waiting.
Please save us.
I'm waiting for you.
Okay. It figures that this subject would come up at some point in my reading. Sex is important to many midlife women. Did you know that?
It's pretty important to midlife men too, by the way.
You're lucky you didn't answer my question, though. The mechanics of sex may become a little more difficult after menopause, but most women will continue to be sexually active as long as they feel sex is important. If you go into midlife sexually active, you're going to continue to be sexually active. Listen to this part.
All right.
Women place a high priority on kissing and hugging.
Oh.
Kissing and hugging.
All right.
That's it? That's all you have to say?
I already said if you don't use it, you lose it. Does that apply to this as well? But it's very important because, you know, you mentioned earlier about wine and alcohol, and as you may know, I do geriatrics. And a central theme, believe it or not, in longevity in our patients, I've found, is that they usually use some alcohol during their days, and they're sexually active. And I think that those two things, either in combination or separately, promote longevity.
As people get older, though, there are more elderly women and very few elderly men, so it's tougher for the women to remain sexually active.
That is a problem.
Okay.
That is a problem.
Let's talk about oysters.
Okay.
All right, that's supposed to be an aphrodisiac, isn't that right?
That's what I've heard. You want to tell us more?
First of all, I hate the way it looks when somebody's eating an oyster, and just sucks it in. It's disgusting, but that's just my opinion. One serving, 3 medium-sized oysters, has 122 calories and is rich in vitamin B12 and protein. And get this, not only is it a good immune booster, its zinc level is 493% of the mineral's recommended daily value. 493%.
Wasn't there something about if the month had an R in it, you couldn't eat it?
That's not true.
That's not true?
No. We used to always go by that, that if it has an R in it, don't eat them. But April and September are not good months for oysters, and they have R's in them.
An old wives' tale.
Very old wives' tale.
It's a good thing she's not an old wife, right?
I feel, never mind. Okay, staying active, we've been talking a lot about that on this show, can prevent breast cancer. Breast cancer is the most common cancer in women. Women over the age of 70 have a 1 in 13 chance of getting breast cancer. We know that that's a problem, and people taking hormone replacement therapy increase their chance for breast cancer. Women who exercise regularly have a smaller chance of getting breast cancer. So,
Row, row, row your boat.
is there anything that you'd like to say about that?
Just because one's getting older, I think there's been some controversy here about, well, I don't need a mammogram anymore. I think it's important, first of all, you do self-breast exams, although they've kind of fallen off the wagon in terms of recommendation. But nevertheless, yeah, believe it or not, it's
Well,
not
you told me you still had to keep doing them for me.
Absolutely. You need to check your breast on a regular basis. The other thing is you really do need to get your mammograms. And even then, sometimes mammograms may have a 10% miss rate, if you will. Especially if you have dense breasts. And I think what's going to come about at some point in time is we may actually get into MRI imaging at some point, because I think that that's going to give us a little bit better detection. And it's very frustrating because breasts are out there, we can examine them, we can feel them, we can mammogram them, and yet still we have this breast cancer rate which has remained almost unchanged. So it's very frustrating, and God knows what else in the environment is influencing this besides hormones. So we need to work on it.
And certainly the mammogram has played a role in my health and has made a difference for me when I ended up having some problems that I didn't even know I had.
Yeah, so just because you're aging gracefully, keep that in mind. You still need to go for cancer screening.
And speaking of aging gracefully, one part of you that you definitely want to have age gracefully are your eyes. And sometimes we forget about taking care of our vision. First of all, make sure you wear sunglasses. Even in the winter, you should wear sunglasses all year round. The UV blocking material, a high-fat diet will contribute to diabetes, which will affect your eyes and can damage blood vessels in your retina. And finally, new advice, break the habit. Here it is. Do 20-20-20. 20 minutes on your computer, look 20 feet away, and stare at something for 20 seconds. And that will help your eyes. 20 minutes on, 20 seconds off, 20-foot distance.
You know, that really rings a bell. You're not going to believe this, but when I was at Holy Trinity in like 3rd or 4th grade, we used to have a Dr. Blum, B-L-U-M, who was an eye physician, come and lecture to us. And he repeatedly told us to take time during the day and look as far away as possible to rest your eyes. It stuck in our heads, believe it or not.
And he was right all those years ago.
Ahead of his time.
Okay, I'm going to give you a quiz now. True, false quiz. Are you ready?
Do it.
It's all about heartburn.
Heartburn.
Yep. I caused my heartburn by eating the wrong foods.
Wow. I think that's false.
You are correct. I can cure heartburn by eating only bland foods.
I think that's false.
You're doing good. I can take as many antacids as I need to treat myself.
That's a no.
And heartburn never turns into a serious health problem.
That's a no as well. We see a lot more reflux, gastrointestinal reflux. The acid comes up
Out
into
of your stomach?
Yes, gastroesophageal reflux disease means that the valve between the food tube and the stomach is a little weak, and acid will shoot up there. Foods you may think are an issue, but it really isn't. It's more of an anatomical problem. We see it more this time of spring. If you're heavy and your stomach's pressing on you, that's a problem.
If you eat late at night.
Yes, and there are a variety of things, chocolate, nuts, alcohol, nicotine, which will make things worse. But here's the key point. Chronic reflux, chronic acid can actually cause a deterioration of the food tube area, and that can turn into not only some scar tissue, but it can turn into esophageal cancer. A precursor to that, of course, is called a Barrett's esophagus. So it's important that if you have continued symptoms, get a scope to get a proper diagnosis and treatment.
And we'll be right back with the final segment of It's Your Health. Welcome back to the third and final segment of It's Your Health. And I must say, you are looking very dapper here. Sit back and let me see. Philip J. Benyo, MD. Why does it say medicine?
Well, I do internal medicine and geriatric medicine as well. I don't know if they knew how to spell geriatrics.
Oh, that's not nice. And over here it says Lehigh Valley Health Network. Tell us a little bit about that.
Right. Well, of course, as you know, Lehigh Valley has merged, if you will, with Hazelton General, and we are now part of that system. And the Alliance Medical Group will soon be part of a 1,000-person medical group when you combine Lehigh Valley with ourselves. So we're very excited. We feel as though all ships will rise in terms of health care up to the area. So we're really proud to be part of the Lehigh Valley network. And you will too, and you'll see the difference because they, as their logo says, are passionate about medicine. So, you know, as an aside,
I didn't want to say anything anyway.
I went to see one of my older patients in a nursing home, and they said, "Hey, last time you wore that white coat, you were in your father's meat department, delicatessen."
In high school.
Right, exactly. So it brought back some memories.
So does this mean that you are working for Lehigh Valley?
Yes.
So is your practice gone?
No, we're still here and we're still seeing patients. We're just part of a larger group to help serve the community.
Everything's pretty much the same. The staff is the same building. You're basically still just good old Dr. Benyo.
We hope to be bigger and better as time goes on.
And I'm sure you will be.
Okie doke.
Okay, let's get into some information about cooking because I know a lot about cooking.
There's truth in advertising here, sweetheart, now. Come on.
What we're going to talk about is chicken. First of all, 3 ounces of boneless breast contain 31 grams of protein and heart protective B vitamins. But let me ask you this question. When you take the chicken out of its packaging, when you bring it home, should you rinse it off?
You know, old school was yes, rinse it off, but you're probably going to tell me no, right?
I'm going to tell you no, you shouldn't rinse it off because there is some bacteria and possibly salmonella and stuff on that chicken. And when you rinse it off, you spray that all over yourself, You get that water on the sink, you get it everywhere, and what you're doing is spreading out that the bacteria.
Oh.
So take it right from the container and put it on in your pot or in your frying pan hot, and it will kill all of that bacteria, and you won't have that problem.
Jeez, that's
so the
interesting.
rule has completely changed, and I only know that because of my cooking abilities.
Oh, please. When's the last time you cooked a meal, sweetheart? Now be honest.
Yesterday.
Oh, really? That's
You
right.
weren't home.
She made me soup. That's
No, I had to put something. I had to put a
peanut
something
butter
in
and
the-
jelly sandwich.
Never mind. And I'm very good at those.
Okay, her specialty.
Okay, a study that looks at health, positivity, and other traits in older couples, which we, of course, are not. Long-term unions stay happy if the husband has an agreeable personality and is in good health. Whether the wife is agreeable and in good health doesn't make a difference. But if the husband has a good health, then they can pretty much count on having a good, long marriage.
No kidding.
Yeah.
So I'm stuck, huh?
You're agreeable?
Yeah.
Oh, okay. So I'm glad you told me that because
Agreeable and healthy,
I
yes.
might not have been sure about that. You know, this information here, we're going to show up on the screen. There's so many that we'll just be able to touch on them just for a second. But there are 15 signs for women that they might be suffering from cancer, and they're signs that we often overlook. So I'll mention if you want to say something
Sure.
really quickly. Unexplained weight loss.
Always a concern,
Okay. Bloating.
right? Sometimes people with ovarian issues or something going on in the belly can notice bloating and can't put their finger on it.
Breast changes.
Obviously.
Between period bleeding or other unusual bleeding.
Yeah, I think bleeding is not good, so you have to
Bleeding
track,
is definitely not
you have to
good.
track that down.
Skin changes.
Right.
That would be like
A dimpling on the skin or a mole that has changed color or is bleeding or is aggravating you.
difficulty swallowing. I had that one. Blood in the wrong place. Abdominal pain with depression. How about that? Indigestion, and I'm almost finished. Mouth changes. Mouth sores.
Sores and
Sure.
things.
Unusual pain. Changes in your lymph nodes. Fever, fatigue, and a persistent cough. That's a lot right there.
Right. And I think the bottom line is if you kind of know your own health, and if you feel as though you've had a change in your symptoms, we really should try to track them down and try to explain them.
It's just like we talked earlier about if you think you're having a stroke, then go and see if you're having a stroke. And if you're wrong, good for you. Same thing with these symptoms. If you think it might be something, go and find out, right?
Yep.
It all goes together.
Sounds good.
You're very agreeable.
I want our marriage to last.
Oh, okay. Everyone out there, you heard him say that now. We have millions of people who heard that. What we're going to talk about next is something that people use all the time. Liquid soaps and wipes that are already dampened for you to use. People are getting rashes from them. And pre-moistened wipes and liquid soaps, the skin reactions to a preservative in it are on the rise. And these moistened wipes should not be used all the time, not even on a baby's butt. And the preservative they're trying to get rid of. So don't even use the liquid soap all the time.
Yeah, I think anything too frequent, you can actually change the normal bacteria that are on your skin that are good bacteria. And frequent hand washing, for example, when I was in my training, we would scrub for surgery, and you had to scrub with iodine for minutes at a time and do this every time you went into a case. Your hands would be raw and get dry and cracked and get infected because we were washing off the good bacteria.
And now it's time to wash off yet another show.
Is it that fast?
Down the drain.
I told you it's the fastest half hour in television history.
We thank you so much for joining us, and we hope that you get to soon enjoy beautiful spring weather. The robins are back. They're waiting for the weather to change too.
Thank you for allowing us to come into your home, hopefully to inform and entertain you. Remember, you're watching It's Your Health, your leader in healthcare information.
It's your health.